Dr. Ben Beach, and I'm here to talk about periodontal disease. This is a disease that people really are unaware about how much it can affect your teeth, your gums, your overall health. People with periodontal disease are more apt to get diabetes, heart disease, stroke, other overall health implications that can really be avoided by coming to the dentist, having your teeth cleaned, and if you need any perio treatment, we can certainly treat you here for that. Periodontal disease really starts with gingivitis, and that's when you haven't had your teeth cleaned in a while. You start getting a little bacteria around your gums want to swell, and anytime you floss, your gums start bleeding a lot, or if you brush your teeth, your gums bleed a lot. That's the early signs of gingivitis, okay? And gingivitis, over time, if ignored, leads into periodontal disease. And periodontal disease really is when you get a lot of plaque, a lot of tartar and calculus up underneath your gums because you hadn't had it clean in a long time. And that bacteria attach to that tartar and calculus, and over time that bacteria will actually start eating away at the soft tissue and the bone around your teeth to the point where your teeth start getting loose. And we've seen cases where their teeth get so loose they can just pop out their own teeth with their own fingers, is how loose their teeth will get. As you can see in this model here, it's kind of an example with somebody with periodontal disease. If you kind of peel these gums back a little bit, you can see a bunch of tartar, that dark stuff around those teeth and those gums show exactly what I'm talking about with that tartar and that calculus, and over time it'll cause that bone to start resorbing around there. And eventually these teeth with tartar and plaque and bacteria that stay down there long enough, these teeth will get loose over time and will come out. There are ways to treat this. We can bring in, we numb your gum tissue up, and we can actually scale and do some deeper type of clean that can remove all this stuff so your gum tissue can heal back in normal placement, and so you can keep your teeth longer. As far as the bone loss that happens over time, we can do bone grafts through a gum specialist's office. He can do bone grafts. There are other motives of treating that, but once you've lost bone, you're really not going to regain in that area without having to come in there and replace it with some sort of grafting material. But periodontal disease is one of those serious issues people really need to be aware of, because this type of disease is kind of like the foundation on your house. I mean, if you've got a cracked slab, you definitely don't want to build a beautiful $1 million mansion on a cracked slab, whereas just a patient with periodontal disease, we wouldn't do a lot of crown and bridge work and implant work if this type of disease was in the mouth, because it could definitely alter our treatment. If we were to do that, it's more expensive treatment in your mouth. But once again, if you have any more questions, please call us. I'm Dr. Ben Beach at Shreveport Bossier Family Dental Care, 318-686-7470.